Hello, my name is Joanna Przepiorkowski, and I am an epidemiologist working for the Public Health Agency of Canada. Before I begin this presentation, I would like to start off with a land acknowledgement. I would like to acknowledge the territory of the peoples and lands of the Anishinaabe Algonquin Nation, on which we are learning, working, and growing today. In this presentation, I will be introducing the Global Public Health Intelligence Network, also known as GPHIN. GPHIN is a program of the Public Health Agency of Canada, sometimes called PHAC for short. In this presentation, we will provide an overview of GPHIN, how it works, its values, and its impact. You can pause this video at any time to better review any of the information on the screen. Let's begin. Here you will find a high-level organizational chart of the federal health portfolio. The health portfolio consists of agencies and departments that support the Federal Minister of Health in maintaining and improving the health of all people in Canada. The departments and agencies included in the health portfolio are Health Canada, the Canadian Food Inspection Agency, the Public Health Agency of Canada, the Canadian Institutes of Health Research, and the Patented Medicine Prices Review Board. GPHIN is Canada's early warning, event-based public health surveillance system, also known as EBS. As EBS system, GPHIN provides increased situational awareness for PHAC and GPHIN subscribers. GPHIN monitors publicly available information, also called open source information, in real time to identify potential public health hazards, including human and animal infectious diseases, product safety, substance use, as well as biological, chemical, environmental, and nuclear events. GPHIN searches for and shares information as signals in its reporting. It is important to note that GPHIN analysts do not verify signals. Signals identified by GPHIN are passed on to partners and stakeholders for their further verification and action where appropriate. GPHIN is made up of three essential components. The first component is the GPHIN operations team, which includes human expertise at the core of the program. This team consists of specialists with multidisciplinary and multilingual health and science abilities who skillfully scan, review, refine, collate, and interpret open source information. The GPHIN operations team also shares signals of potential public health threats with partners and stakeholders for their review and assessment. GPHIN analysts work in 10 languages, including Arabic, Chinese traditional and simplified, English, Farsi, French, Hindi, Portuguese, Russian, and Spanish. The second component is the support team, another critical human element of GPHIN. This multidisciplinary group includes technical, policy, and epidemiology experts that are dedicated to the continuous enhancement of the GPHIN program and platform. They work closely with the operations team to ensure seamless and continual functionality and innovation. The third component is the technological aspect, the GPHIN platform itself, an information management tool that collects, collates, filters, and classifies media reports and other publicly available information sources for analysts to review. Before we describe how event-based surveillance, or EBS, works with other types of public health surveillance systems, we must first define two important terms, events and signals. Public health events are identified through the monitoring of signals. Events and signals are closely related but are different in important ways. Potential events are identified through the early detection of signals. GPHIN and the Pan American Health Organization, better known as PAHO, both use the same definition of a public health signal, which is the initial detection of a potential public health event prior to verification. This may consist of information or reports potential exposure of human beings to biological, chemical, or radionuclear agents, or of the occurrence of natural or man-made disasters. An event is a signal that has been verified. GPHIN uses the 2005 International Health Regulations definition of a public health event, which is a manifestation of disease or an occurrence that creates a potential for disease. GPHIN functions as an independent program and also collaborates with other types of surveillance within PHAC to create a fulsome picture of the public health environment. This diagram shows two halves of a circle. The left half is labeled indicator-based surveillance, or IBS, and the right half is labeled event-based surveillance, or EBS. Together, these two halves form a complete system. These two types of public health surveillance complement each other and together play critical roles in public health situational awareness and risk assessment. IBS is the most commonly used type of surveillance in public health. IBS is focused on identifying specific known diseases, symptoms, hazards, or predefined case definitions as they occur within a population. IBS methods include networks for notifiable disease reporting and laboratory disease reporting. Data collected through IBS are analyzed to detect disease outbreaks, to identify trends and patterns, and to assess potential risks at the clinical or community level. These data require confirmation and reporting, so the information received through these channels is often time delayed. EBS is focused on identifying public health threats in a timely manner. To achieve this, EBS uses both structured and unstructured data, including verified and unverified reports. Examples include official media sources, public health bulletins, and unofficial sources such as news media. GPHIN limits its social media monitoring to official government and organizational accounts that are verified, publicly available, and do not require an account to access. EBS uses an all hazards approach and is able to report on both known and unknown diseases, as well as other hazards discussed previously. With its variety of sources and timely reporting, the EBS system can often identify potential public health threats much earlier than IBS. PHAC primarily conducts disease surveillance through IBS methods, including notifiable disease surveillance systems, sentinel surveillance, and laboratory surveillance. This reporting is typically conducted on a regular basis or after the confirmation of a specific disease or condition. GPHIN is PHAC's flagship EBS system designed for the rapid detection and reporting of potential public health threats. These threats may include clusters of cases, rumors, or unconfirmed reports of symptoms in the media or incidents related to contaminated food or product safety. A key feature of GPHIN is its use of open source information to identify and track emerging threats. Open source data refers to publicly available information that anyone can access. Examples of open source scanning include media articles in various languages from around the world, press releases, social media reports from public health organizations, and really simple syndication feeds, better known as RSS feeds from relevant websites. Some of the sources available on the GPHIN platform are from subscription-based services, such as media outlets which paywall their articles. Again, GPHIN monitors social media, but only from official government or organization accounts that are verified, publicly available, and do not require an account to access. When combined, IBS and EBS complement each other, offering a more comprehensive view of the public health threat landscape. Building on the concepts introduced in the previous slides, we now focus on GPHIN functions as an EBS program. The diagram on this slide introduced the process of data collection, processing, and analysis within GPHIN's daily operations. To fully understand GPHIN's effectiveness as an EBS system, it is important to revisit the concepts from the previous slides. The GPHIN system is supported by both technological and human components. In the first stage of the process, technological tools are used to collect and process information from various sources. As shown in the diagram, Factiva, a large global news aggregator, is complemented by RSS feeds, independent news aggregators, and manual input of articles conducted by analysts. In the second stage of the diagram, analysts play a critical role in evaluating and curating information. The GPHIN platform employs artificial intelligence, better known as AI, to assign each article a relevancy score, ranging from 0 to 1, with 1 representing the highest level of relevance. Articles that receive a relevancy score higher than 0.85 are automatically published to the GPHIN platform. For articles with a relevancy score between 0.35 and 0.85 inclusively, analysts manually assess whether they should be published or excluded. Articles scoring lower than 0.35 are automatically excluded by the system through a process called trashing, which removes them from consideration. GPHIN analysts also review trashed articles to ensure they were correctly processed. The third stage depicts the daily analyst review of the articles published on the platform to assess their inclusion in GPHIN products. Additionally, analysts review and, as required, assign tags to articles to collate them for various purposes. They also identify articles for flagging for inclusion into reports for program areas that may require further investigation and risk assessment. As mentioned previously, some published articles are then included in GPHIN products, such as the daily report, where they can be flagged for specific program areas. It's important to recognize that GPHIN serves as a first step in PHAC's integrated public health surveillance system. GPHIN identifies potential public health threats and strengthens surveillance by creating products such as our daily report or early warning notifications, which are distributed to subscribers, including those within our agency, who take the next steps in verification, risk assessment, and response. GPHIN does not conduct risk assessments nor provide recommendations. Moving on to the key products developed by GPHIN, the first product we will introduce is the GPHIN platform itself. The platform is available to subscribers both across Canada and internationally. Access to the platform is limited to individuals affiliated with public health agencies or organizations. Members of the general public and media are not permitted to use the platform. The platform is an information management tool where users can conduct independent searches of the database, review recent or archived results, and apply various filters to refine their queries. The platform is accessible 24 hours a day, 7 days a week. Next is the daily report, which is the most frequently distributed GPHIN product and is exclusively available for domestic subscribers only. The daily report provides a summary of the most relevant public health articles published to the GPHIN platform that day. Articles included in the daily report aim to identify issues posing a potential public health risk to Canada and around the world. The report is sent out by 8:30 a.m. Eastern Time each workday, and many of our domestic subscribers report that the GPHIN daily report is the first thing they read every morning. The third product is an early warning notification, also known as an EWN, or colloquially within the GPHIN program as an UN. EWNs are email reports sent to both domestic and international subscribers, highlighting an emerging public health signal that may require closer attention from public health professionals. Each EWN includes a summary of the situation along with links to the original sources. Additionally, the notification provides a rationale for issuing the report and documentation regarding the source of the information. It is important to note that while an EWN identifies a specific public health signal, it is not a first response to an emergency and does not indicate that a public health emergency is occurring or imminent. The next product is the Emerging Issues Report, or an EIR. EIRs are similar to EWNs, but differs in terms of context. An EIR is issued in response to shifting patterns over time identified by analysts related to a specific public health issue. EIRs are available to both domestic and international subscribers and are designed to draw attention to new developments or shifting patterns in the public health environment. It consists of an email with a summary of the situation and copies of recent news articles on the topic. The GPHIN program can also develop special reports on an ad hoc basis for various reasons. Any GPHIN user, whether domestic or international, can request a special report. These reports are typically requested in response to large gatherings that could pose public health concerns, such as a large sporting or political gatherings. Each request is evaluated on a case-by-case basis and the target audience may vary depending on the nature of the report. In public health emergencies, response time is critical. Any lead time to develop an effective response is essential to saving lives and reducing morbidity. This slide presents a table of public health emergencies spanning more than 2 decades where GPHIN successfully provided early detection of a public health event. In some cases, the signal was detected days before official confirmation, while in others, GPHIN provided several months of lead time. GPHIN has successfully detected the first signals of many major public health emergencies, including the 2009 H1N1 influenza pandemic, the 2015 reemergence of Zika virus, and in late 2019, the first signal of what would become the global COVID-19 pandemic. Some other honorable mentions for detections made by GPHIN analysts are SARS in 2003, vaping-related illness in the US in 2019, and Mpox in 2022. As mentioned earlier, GPHIN's subscriber base is global, with thousands of individual subscribers across hundreds of organizations. The value of GPHIN as a program, along with the work of its health science experts, epidemiologists, and support team, is felt daily around the world, including here in Canada. GPHIN subscribers includes Canadian Federal Health Portfolio programs, including our partner agencies, along with other federal government departments, provincial, territorial, and other public health partners in Canada. In addition, non-governmental organizations at home and abroad are part of the subscriber base. Internationally, ministries and departments of health, centers for disease control, and other government departments from more than 70 countries also subscribe to GPHIN. Key subscribers include United Nations agencies such as the WHO, the Pan American Health Organization or PAHO, the World Organization for Animal Health, WOA, and the Food and Agriculture Organization. As we close off this presentation, here are GPHIN's key takeaways. GPHIN is Canada's flagship early warning event-based public health surveillance system for all hazards. The type of hazard surveillance GPHIN conducts is called event-based surveillance, or EBS. As an EBS system, GPHIN uses open sources of information such as media articles for its surveillance. GPHIN analysts review and assess articles on the platform. GPHIN provides several core products to its subscribers, including the GPHIN platform itself, daily report, early warning notifications, emerging issues report, and special reports. The responsibility of assessing risk and managing public health events fall to specific stakeholders and subscribers receiving GPHIN reports. And finally, GPHIN is an effective event-based surveillance system which has identified several major public health emergencies earlier than their first formal report, providing public health professionals with critical lead time. Thank you very much for listening to this presentation. If you're a new subscriber or have any questions regarding this presentation or about GPHIN in general, please contact us via email. We are happy to answer any questions you may have. Thank you.